everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very interesting topic, which is the exercises. So as we all know that exercises is one of the activity which we must perform in order to keep ourselves fit and healthy. These exercises is any physical activity involving the muscles that elevates the heart rate above the resting level. By performing exercises, it helps to reduce the joint pain, the stiffness, and also increases the flexibility, the muscle strength, and the endurance. So, exercises is any physical activity which involves the muscle that we perform in order to keep ourselves fit and healthy. And when we are performing these exercises, it is not necessary that you must do only one, but here there are wide variety of exercises that we can perform depending on our disease condition or even depending on the muscle strength that we want to work on. So what is the importance or what are the benefits of these exercises? The first one is it helps to normalize the glucose tolerance. It improves the gait and balance. It improves the cardiovascular function. It also increases the energy, which promotes the bone density. It improves the mobility of the person, and it also promotes the weight loss. So here, in order to lose weight, there are also various exercises that you can perform. Not only that, but it also reduces the blood pressure, it lowers the cholesterol level, as well as it promotes rest and relaxation that will improve the sleeping pattern of an individual. So this is the reason why we nurses must always educate the patient to perform various exercises, because by doing so, these are the various benefits that one can get. So now let's move on to the types of exercises. So here there are several exercises that one can perform in order to promote their physical as well as their psychological health. So the first exercise which one can perform in order to improve their physical and their psychological health is the aerobic exercise. By doing this, it helps to improve the cardiovascular function as well as it helps to assist with the weight control. And it also helps to improve the general functional ability of an individual. And the second one is the strengthening exercise. So these exercises are usually performed in order to maintain or increase the muscle strength. The third one is the isometric exercise, which is done in order to maintain the muscle tone and strength. Whereas the fourth one is the isotonic exercise. So these exercises are also done in order to increase and maintain the muscle tone and strength. And it also helps to maintain the shape of the muscles, maintain joint mobility, and also improve the cardiovascular fitness. The fifth one is the isokinetic exercise, and these are usually done in order to increase the muscle strength, power, and endurance, especially when they have to perform any activities that involve pulling and lifting. The last and the most important one is the ROM exercise, which is the range of motion exercise. So these exercises are mainly performed in order to maintain the joint movement as well as to maintain its flexibility. So from all of these six, the most important one here is this ROM exercise. Because in the hospital, you will be encountering many patients with restricted mobility, and because of this, they will not be able to perform one or more of this RM exercise independently. In the hospital, you will be encountering many number of patients with restricted movement, so these patients will not be able to perform all or some of the range of joint motion exercises independently. So here the easiest intervention which you can do for these patients in order to maintain or improve their mobility is by the use of these ROM exercises. Because here if joints are not allowed to move periodically, then it may become fixed to one place. So in order to prevent this from happening, it's very important that the client must at least perform these ROM exercises. So now moving on to the definition. This range of motion is the range which is measured in degree of circles through which the bones of a joint can be moved. It is also defined as the maximum amount of movement which is available at a joint in one of the three planes in the body, that is the sagittal, the frontal, and the transverse. So as I have said that this range of motion is a range which is measured in degrees of circle through which the bones of a joint can be moved. And as I've said that here, It is the movement of a joint in one of the three planes which is present in the body, right? That is the sagittal, frontal, and the transverse. So what is the sagittal plane? This is a line that passes through the body from the front to the back by dividing the body from side to side and even by dividing the body into left and right side. Whereas the frontal plane is the plane that passes through the body into front and back. Whereas the transverse plane is a horizontal line which will be dividing the body into the upper and the lower portion. So as you can see in the picture that these are the three types of plane. This range of motion is also of two types, that is the active ROM exercise and the passive ROM exercise. These active ROM exercises are used for those patients who are able to move his or her own joints independently, whereas the passive exercises are used for those patients who does not have the voluntary motor movement. So these are the two types of exercise, and before one perform these exercise, there are few points to be noted. The first one is, while assessing the ROM, the nurse should physically examine the client for stiffness, swelling, pain, limited movement, and also unequal movement. The nurse must also schedule these exercises at a specific time, perhaps along with the other nursing activity. And if these exercises are to be performed by a weak client, then the nurse must make sure that she provides the maximum support while the client perform most of these movements. Because here they may not be able to do it by themselves, right? Since they are weak, they will not be having the necessary stamina to do it. So here it is your responsibility that you provide maximum support and to make sure that they are being able to do it according to their capabilities. As a nurse, the exercises which you will be assigning to the patient must also be active as health, and it should allow the maximum mobility. Unless it is contraindicated, then whenever you are telling them to perform these exercises, the plan must include moving the extremity through as nearly full range of joint motion as possible. The movement which the client will be doing must also be carried out slowly and smoothly so that it does not cause them any pain or discomfort. And you should also make sure that you should never force a joint beyond its capacity. That is why as a nurse, it is your responsibility that before you assign any exercises to them or before they even perform them, you must assess their muscle stiffness, if there is presence of pain, swelling, limited movement, or even of unequal movement. And also here, each movement which the patient will be doing should at least be repeated 5 times during the exercise. So we will be discussing about different types of exercises, different types of movement which one can perform in order to, move the joints, right? So there, when we will be discussing, you will get an idea of what are the various movements that a patient can do. And when he or she is doing each and every movement, you should make sure that at least they repeat it 5 times while they are doing it. And when the client is performing the passive range of motion exercises, then here the nurse must stand at the side of the bed closest to the joint being exercised. Because in this manner, it will prevent overreaching. It also prevent unnecessary strain to your muscles as well as to your back. So here it is highly advisable that if you have to assist the client in performing certain exercises, then you must stand at the side of the bed which is closest to the particular joint being exercised. So these are the various points to be remembered whenever one is performing these ROM exercises. So since I've said that there are 2 types of exercises, which is the active and the passive, these active exercises are used by those patients who are able to perform the joint movement by themselves, whereas the passive exercises are used by those patients who are not able to do it by themselves, right? Because there is an altered mobility. So what is the cause of this altered mobility? So the first one is the congenital problems. So these congenital problems are the ones which is present since birth, right? So here if there is any problem that can affect the normal musculoskeletal as well as the neurological development, then it can also lead to an altered mobility. And the most common example for this is the congenital hip dysplasia as well as the spina bifida. The second one is the neuromuscular deficit. So here any diseases that impairs the ability of the nervous system to control the muscular movement as well as the coordination, then it can hinder the functional mobility of an individual. So here the most common example is the muscular dystrophy. So here, even when an individual is having any of the neuromuscular deficit, then it can also lead to an altered mobility. The next is the musculoskeletal deficits, which includes conditions such as osteomalacia or even osteoporosis. The next is the chronic health problems. So here, if an individual is suffering from any chronic conditions or chronic disorders that limits the oxygen and the nutrients delivery to the muscles, then it is also one of the cause for an individual to have an altered mobility. And the next one is trauma. So here, this trauma often results in any accidental injury that has occurred to the bones, joints, muscles, tendon, and ligaments. So here, if any of these are being injured because of any accident, then it can also lead to trauma, which can further affect the mobility of an individual. The next is the affective disorder. So here, if an individual is suffering from any affective disorder such as depression and catatonic state, then it can also result in limited mobility because of the physical impairment. And the last one is the therapeutic modalities. So being in this profession, you may have also encountered that there are clients whose movement are being restricted because of a medical problem, right? So here what you will be doing is that you will be providing various restrictive devices such as casts, braces, or splint in order to immobilize certain areas that requires healing, right? So here, even because of the medical condition that the client may be going through, we may have to provide these restrictive devices which can limit the mobility of an individual, which can also later lead to an altered mobility. So these are the various causes for altered mobility. So I'll be concluding this topic for today, whereby in today's session we have discussed about what do we mean by exercise, what are the various benefits that one can get by exercising, what are the types of exercise that one can perform in order to improve the physical as well as the psychological health. And then we have also started discussing about the range of motion exercises, whereby we've come to know what it is as well as what are the two types of these exercise, what are the various points to be kept in mind before we advise or before we assist the client to perform these ROM exercises. And also we have discussed about the causes for altered mobility. So here I hope you have got a clear understanding of this topic. I will be meeting you in another session whereby we will be continuing with this same topic, and I will be teaching you about the types of movement which we can perform at various joints. So until then, have a good day. Thank you.